So a lot of my patients ask me, when is the best time to start seeing a doctor for hormone management? I'm not menopausal yet, maybe I'm 35, 39. Should I be seeing a doctor to talk about hormone replacement? Well, guess what? Our hormones start changing usually around 40, sometimes before that. You know, when we're young and fertile and we're having a period every 28 days and everything's running perfectly, your hormones are working pretty optimally. That's not a time to seek help regarding hormone replacement in most cases, unless you've got something unusual going on. But most of us, or many of us, around 40 start to notice things changing. We call that perimenopause. Sure, you're not menopausal yet. Your periods haven't stopped. You're not having hot flashes and night sweats yet, perhaps. But perimenopause, which is the time that usually falls somewhere between 40 and 50, can be a very challenging time because our hormones are changing. The most common change that happens is that our progesterone drops in relation to our estrogen. That can cause mood swings, weight gain around the middle, heavier periods, all kinds of unpleasant symptoms that can be easily addressed by adding more progesterone, which is a natural, safe, plant-based, bioidentical hormone. The other thing that drops is testosterone. So our sex drive drops, and almost universally in my study, actually 93% of women 45 and older experience a decrease in their sex drive, and that doesn't feel good. There's a lot of reasons for that, I know, but one of them is decreasing testosterone. So if you're feeling these things and you're in your 40s perhaps, or sometimes even younger, that is a time to start looking into whether some progesterone, perhaps some testosterone might be helpful, perhaps even estrogen once you're getting further closer to menopause, because that's the hormone that drops when we really stop having periods. So in other words, you're not too young if you're 42 and feeling like things are a little bit different. Maybe your doctor's told you, you're fine, everything looks good, you're fine, but you don't feel fine. And that doesn't feel very validating. So we can look into those things in detail, check your hormones, see exactly what's going on. We check your vitamin levels, vitamin D, vitamin B, sometimes micronutrient analysis to really optimize your diet to get you feeling good again, because you deserve it. You deserve to feel good. Don't believe people who tell you that you're fine when you don't feel fine, because we can optimize these things. And I don't want to be normal for a 53-year-old. I want to be optimal for a 53-year-old or a 63-year-old or an 83-year-old. And that's what we're talking about at CompleteMidlifeWellnessCenter.com. Come visit us.